Hey everybody, this is Dr. Kyle with Ice Clinics bringing you your next tip for Tuesday. In our video today, what I'm hoping to show you is a little better understanding of our upper neck, the mechanics behind that, and how important that is with our neurology that branches off on that area of the spine. Now, one example I want to use in general, because we've had a few patients come in and talk to us about eye strain, is when they catch themselves trying to really focus on something with their eyes. They'll say they get a tension type headache or kind of a pressure around their jaw. And what I want you to understand is when most people will strain with their eyes, say looking at a computer desk, driving, or a computer screen, or looking at a phone, typically what happens with the eye strain is that we also will jut our head forward slightly. And that little bit of jut can put a lot of pressure on this upper neck and the neurology that goes to it. So as opposed to that position, rather than the eye strain causing the trouble, maybe we should change our focus and think about the neck position that we're putting ourselves in is causing extra irritation to that anatomy. So one thing to remember about our upper neck, and I've talked about this in regards to other conditions around this neck of the woods, is your upper vertebra, called your atlas, your occipital bone, which is the bottom of your skull here, and your jaw are very intimately related in this small space. And you can even see where your ear hole is right there as well. So any shifting of your jaw forward or backward, your skull forward or backward, side to side, this upper vertebra here, any shifting relative to each other in that area and cause all sorts of symptoms. So appreciating this relationship, again, is what I'm trying to get you guys to appreciate. Now, one other thing I want you to understand is the atlas sits on top of the axis bone. So you C1 and C2, and that's where you get a lot of your turning ability with your neck. So when you turn your head side to side, a lot of it comes from those two vertebrae. So if you consider those two concepts, when we come to a skeleton here, you can see here's your C1, here's your C2. If you have a C1 bone that is maybe glided forward slightly relative to the skull, that will compress the jaw and the ear canal here. But on the same token, if you have not just that anterior shifting of the vertebra, but say you have a little bit of rotation of that C1 on that C2, you can see how this guy juts out maybe even a little more. And so what you end up doing is this area of anatomy that is generally very compressed with stuff, all of a sudden gets irritated by bones that should not be in areas that they are. And that can relate back to a lot of the symptoms associated in this neck of the woods. So again, for you out there watching, think about the average person that's straining their eyes, maybe looking at something, zooming in their head a little bit, or maybe it's slightly off to the side and then there's a little bit of rotation like that. You can really set yourself up to put a vertebra in that position, which can cause all sorts of symptoms. And much like I said, in this particular context, that eye strain may not be the eyes, but the mechanics behind the neck and the skull. So hopefully for everyone watching, you kind of can put together the importance of this neurology, the mechanics of how this works, and understanding some of those symptoms you might experience in your head. This is a perfect reason to go to a chiropractor and have that upper neck checked in regards to a lot of those symptoms that may or may not present around the head. So if there's anything we can do to help with any of you out there, please let us know and get a hold of our clinic. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.